Hi, everybody. Welcome. My name is Leah Gropo. I'm one of the dietitians and diabetes educators at Stanford Healthcare. And I really have the great pleasure in welcoming everybody to our type 1 diabetes series. So this is the first time that we've been able to do this, and I'm so thrilled at the lineup. So first off, I wanted to explain why we're doing this in November. So November is National Diabetes Awareness Month. It's also the month that World Diabetes Day falls in. And so really we want to just celebrate and provide education definitely through this month. So today, I'd love to introduce you to Dessi Zaharieva. She's a PhD at Stanford at University. She is an instructor and exercise physiologist currently working in the pediatric endocrinology at Stanford University under the supervision of Dr. David Moss. Her research focuses on strategies to manage blood glucose control around exercise in youth and adults with type 1 diabetes. She is also working on implementing exercise education and monitoring physical activity patterns and behaviors for newly diagnosed youth and type 1 diabetics. So without further ado, Dessi.
Thank you, Leah. Hi, everyone. It's so nice to be here. I appreciate everyone making the time. I know it's the evening for most of us, and you guys can enjoy your dinners or your snacks. I look forward to kind of opening up the discussion at the end. So we're going to do kind of a shorter presentation, but give some more time for questions at the end. So I look forward to being able to chat with everyone. So today we're going to be talking about how to stay active to feel your best. And again, as we already mentioned, that today is kind of part one of a 3-part series. And I really hope that everyone is able to attend the next kind of part 2 and part 3. They're probably going to be far more entertaining than my sessions. So definitely make sure you're there for those sessions in the coming weeks. I'll share the details at the end. So I have no disclosures to report. Some people like a little bit more formality, so I threw in kind of the objectives, things that we're going to cover today, understanding some of the benefits of regular physical activity, some relationships between exercise and dysglycemia, both highs and lows, and describing how to prevent some conditions like hypoglycemia around exercise, as well as some exercise recommendations for people with diabetes. So predominantly type 1 is going to be my focus today. Okay, so I usually don't throw in slides about myself. I told Leah I'm going to do this, and I hope that people start doing this more in the future for presentations. We want to know more about each other and kind of support all the research that we do. Stanford has an amazing community. And yeah, so some of my background, I was born in Bulgaria, but actually raised in Canada. I trained martial arts for over 20 years and actually represented Team Canada at the World Championships and medaled for my country, which was pretty cool. In the last kind of 6 or so years, I've been moved over to doing more mixed martial arts. So Brazilian Jiu-Jitsu, kickboxing, wrestling. But I can say the past basically 2 years now, that's changed as well, because in a pandemic, it's difficult to be doing these kinds of sports, very close contact. Activities have just changed for many people. And we'll talk about that today too. I don't need to go into too much detail in my research, but I do focus on preventing hypo and hyperglycemia during and after exercise with type 1 diabetes. Okay, so I think one of the first questions I always like to start with this is, why do we bother with exercise? Like, why do we care? What are the health benefits? Why do I care so much about promoting physical activity? Well, the answer is there's a lot of reasons on why I try to do this. And I just wanted to list, like, specific to diabetes, there are a lot of health benefits that we can see. We see improvements in overall fitness, reductions in cardiovascular disease, reductions in microvascular disease, improvements in insulin sensitivity. We tend to see this for many hours in recovery as well. Increased well-being. I'm not sure how everyone else feels when they exercise, but I think for me, it's always a mood lifter. I always feel better. In the moment, I can be pretty honest in saying sometimes I don't thoroughly enjoy every moment of my physical activity, but we want to find sports and activities that do bring us joy and make us happy. That makes us want to engage in it more often. We also see for some people an interest in exercising to lose fat. So body fat reduction is something that can occur from regular physical activity. We also see that there is enhancements in glucose control or reductions in hemoglobin A1C with regular exercise. We've seen in both type 1 and type 2 diabetes, everyone is different. I will say that there's no kind of cookie cutter approach to type 1 diabetes and how to manage our diabetes. And you'll hear that a lot from me today. but we do tend to see some improvements in overall glucose control. And I'll share some data on that as well. And on the left, this is a slide that I took from my PhD supervisor, Mike Riddell. He's one of the leading experts in diabetes and exercise. I try to live up to his hype because he always shares such great information. But you can see on the left just a number of other factors and things that, why we regularly should be active. Muscle health, heart health, we see improvements in cognitive function. One of the interesting ones that I wanted to throw in there is sleep duration and quality are improved with regular physical activity. This isn't just for people with diabetes. Those in the audience that don't have diabetes, maybe a child or someone in their family with diabetes, these apply to you as well. Sleep duration and quality can be improved with regular exercise. All right, so we're gonna bring this up. Amy, if you can help us out, we're gonna start with a poll question. Awesome. So poll one, I'll just read it out loud. But basically the first question I wanted to ask is, how do you manage your diabetes? Is it multiple daily injections? Is it insulin pump, open loop, or closed loop? If you're not familiar with those two, we'll touch on that a little bit later and we can talk about it in the kind of Q&A period at the end, or both injections and a pump. That might be a more unfamiliar approach. We call it the untethered approach. Some people actually do use both injections and a pump, and we can talk about how that works. Or other, maybe it's none of those, and then you can just put other. All right, so let's see, we've got about 20%. Wow, we got an even split, 20%, 20, 35. Wow, that's a pretty equal split amongst everyone. So other, open or closed loop insulin pumps, or multiple daily injections. This is great. It kind of gives me an idea of who my audience is. Looks like no one's doing the untethered approach. That's not uncommon, but I did want to throw it in there to think about everybody. And some people might have said other because they're probably like, I don't have diabetes, Dessi. Don't only ask about diabetes questions. You're very right. You can be in that other category. We still care about you too. All right. So the next kind of thing I wanted to discuss, I often bring up this slide. For anyone that's seen me present or attended my talks in the past, you've probably seen me bring this up. And the reason is not because I just want to recycle all my content, but the reason is that this slide really is like a take-home message on if you're going to learn or take home one kind of important tip today, it's understanding that there's a lot of glucose variability that we can see in response to different types of exercise. Now I'm working in new onset type 1 diabetes, and many people at new diagnosis don't realize that these are factors that get impacted by diabetes. So for example, here I just wanted to share, as time is increasing towards the right on that x-axis, we see kind of longer duration activities. And really with that, assuming that you don't have a whack load of insulin on board, and the reason I say that is, I know for me, if I've taken, 5 units of insulin and my blood sugar is dropping, well, I might not see these same impacts. My blood sugar is probably going to keep dropping. But it's important to know that blood glucose trends with anaerobic or high intensity exercise can actually rise. One of the main reasons that this can happen with more intense exercise, it's actually a number of factors. But we see that, counter-regulatory hormones, we see increases in adrenaline, noradrenaline, we see increases in cortisol, lactic acid as a metabolite. A lot of these factors can actually impact our blood sugars and cause a rise in glycemia. These tend to be really short because we can't really sustain them for much longer because we get really tired. Once we get into this kind of purple zone in the middle, which is actually most sports, especially school sports for school-aged children, we tend to see kind of a mix in aerobic and anaerobic, meaning that there's sometimes longer duration. They're not too stressful, but sometimes, they're just longer activities. These tend to sometimes cause a small rise or a small drop in blood sugars. But really the main focus we look at is kind of aerobic activity. Anything from walking to biking to marathon running. For me, I always say my Costco run on Sundays is usually one of these categories. Sure, it's not a structured exercise. Sometimes it feels like it, but actually tends to cause our blood sugars to drop. And the reason is, if you think about it on a large scale, you're using up the glucose in your body. You start using it up, and if you're not replenishing it with carbohydrates, and you haven't made any adjustments to your insulin or adjustments to your carbohydrates, it's very likely that your blood sugar will drop if you have diabetes and you're doing aerobic exercise. So this is kind of why my focus is around how to prevent these drastic either reductions or rises in blood sugars. So on that note, I'm not going to spend too much time on this, but feel free to kind of ask questions at the end. I do want to bring up some suggested blood glucose starting points for exercise. It's kind of busy, but we wanted to add in a little bit more into this slide. And the reason is that depending on where you start exercise, you might consider changing the type of exercise you do. So just taking the information I shared on the previous slide, we talked about kind of aerobic or low intensity. Remember, that typically causes blood sugars to drop, or anaerobic and high intensity may cause glucose levels to rise. Not all the time, but it may. If your blood sugar started in this kind of lower range, you can see that you may require carbohydrate feeding to prevent a low blood sugar. It kind of makes sense. If you start lower, you're that much closer to a low blood sugar. And then on the other hand, if you're starting with a higher blood sugar, greater than 250 milligrams per deciliter, when I was diagnosed, almost 25 years ago now, I was told not to exercise if my blood sugars were above 250. And in fact, there is kind of but that's actually not so true nowadays, because what we know is that if it was maybe you underbolused for a meal and you just had a temporary high blood sugar, it actually could be safe to do aerobic or low intensity exercise, because why wouldn't you do something that could actually help bring your blood sugars down? Maybe you want to avoid doing something that's really stressful that can cause your glucose to rise, but just always think about where your blood sugars are at the start and then how you can tailor your activity. Of course, not in every situation are you going to be able to tailor your activity. For example, kids in school sports, you can't just tell your coach, hey coach, sorry, can't do that. I got to go for a walk instead. Maybe you can, but I think for many people, if you have the choice, just make sure you consider all of these kind of factors that we said, where your starting blood sugar is, and then with that, what type of exercise you might want to do. So next, we wanted to talk about some challenges with diabetes and exercise. We can talk about all of these kind of benefits of exercise and health benefits and how we feel so great with physical activity, but there's also a bunch of challenges. And that's why we're here today, is to try and address these kind of struggles. I think I highlighted the first point here as high circulating insulin. So high bolus insulin, high amount of insulin, once you take it and it's peaking maybe 1 or 2 hours after your fast acting insulin bolus. If it's, you took it for a meal, these are kind of the situations when insulin is peaking. I don't want to say we're in trouble, but we definitely need to consider this when we go to exercise, because the more insulin we have in the circulation, the more difficult it is to maintain kind of stable blood sugars, which is why we often recommend, if you can avoid exercise when insulin is peaking, it may be best to wait 2 or 3 or 4 hours after your last big bolus for a meal. Now, again, that being said, I know a lot of people will say, I can't control when my child is eating and taking insulin. And we understand, whether it's a child or even me as an adult, I do this a lot. I realize I have 4 units of insulin on board and it's peaking. And it just means I probably need a bigger carbohydrate snack to prevent a low blood sugar at exercise time. We're also looking at some of these other challenges. Insulin action, it's a little bit slow, the way that insulin works to get in and out of the circulation. Sure, I will give a lot of credit to the fact that we have faster insulin nowadays, but we still know ultimately, compared to endogenous insulin produced by the body of someone without diabetes, it is very slow to work. To get into the circulation where we need it, we know that it's going to be a delay. There's also a lot of individual variability. What happens to me and the next person and the next person is going to be entirely different. This is probably one of the challenges of why your providers may sometimes have no exact answer, because it's not as easy as you need to do this. In fact, it's more of a, you should try this, but then tailor it to your own kind of approach. We also just talked about pre-exercise blood sugar levels, starting lower versus starting higher. So those are some challenges, but can help predict the likelihood of a low. We also know there's challenges around provider education, patient motivation. We did talk about type, duration, and intensity of exercise. And I will kind of touch on this on the last slide, but CGM accuracy, which is an area that I really like to focus on in my research, and how the CGM, if you are using continuous glucose monitoring, for those that don't know, how it may be impacted during activity. All right, so the next kind of slide I want to bring up, this one's a little bit busy, a lot going on, but I kind of restructured this from a really great study by my colleague in Canada, Dr. Yardley. What types of blood glucose responses do we see to exercise, and what factors can actually impact those blood sugar responses? So I'll throw out a lot of different factors to consider. Even just seeing this list should give you an idea that, well, it's not as easy as do this and do that, and then you'll get a result that works every time. We know that if you do one thing today and the same thing tomorrow, you're going to have probably a totally different response each time, which is why a lot of kind of Tips and strategies that we provide around exercise and glucose management do need to be individualized. I know I keep repeating that, but it is really important to not give up. If it didn't work the first time, the second time, the first month, the second month, you have to keep trying and reach out for, us to be able to do these kinds of education sessions and discussion to help answer these questions. So recent hypoglycemia, we sort of know that if you had a recent low earlier that day, and then later in the day, you're going to exercise, you may have a stronger response and more likely to have a hypoglycemia episode. We call this antecedent hypoglycemia. And sometimes you'll notice if you have type 1 diabetes and you're exercising, you may have been low an hour ago, 2 hours ago, and then you go to exercise, you go low, and then you treat with a juice box, but then you realize your blood sugar is not coming back up. And that could be because you had a low earlier that day. You may require more carbohydrates to actually replenish your stores, and it takes time to bring your blood sugars back up. So make sure you give yourself kind of adequate time. We'll talk a little bit about time of day of exercise, carb intake. Again, when did you last eat? And when did you last take insulin? What intensity is the exercise? We talked about that a little bit already. The environment, are you working out in a hot or cold environment? Are you at altitude or not at altitude? There's so many other considerations that we often forget about or are still actually studying and research to try and better understand. How long are you exercising for? When did you last take insulin and how much? What type of exercise are you doing? Is it a competition day or is it a recreational, fun, casual day of exercise? Kind of the stress associated with physical activity that's a competition setting may actually lead to a greater rise in blood sugars. And if you think about it, just like we talked about, the stress response can cause blood sugars to rise as well. Well, these are also some factors, if we didn't have enough on this slide, of things that are often forgotten about or not considered. We know through research, there's still a lot more to be done. That fitness level, we see that more fit individuals actually have increased rates of hypoglycemia. And we'll talk about that a little bit later as well. And then we see sex differences. So, different fuel utilization between males and females. And we also see differences between age. So basically older age, we tend to see kind of higher blood glucose concentrations, whether that has to do with when diagnosis was, maybe in pediatrics, you're still in a honeymoon period or early in diagnosis, but all of these factors can impact our blood sugars. All right, that's enough of me talking for 1 second. Let's get another poll so I can wake everyone up if you're getting tired. Thank you, Amy. All right, what is your primary concern with exercise and diabetes? We did give you only a single choice here because, to be honest, if it was me, I could probably check off every one of these. But if we could pick one, fear of hypoglycemia, low blood sugars, fear of hyperglycemia, high blood sugars, lack of time, lack of confidence, other, none. I'm a superhero. There's a lot of superheroes in this room. I think we're all superheroes. So feel free to answer. I'll give everyone about a minute and then we will take a look at what everyone had to say. All right, very interesting. I love doing polls. You learn so much. And I love that we have 16% of superheroes. I think that should be closer to 99%. I think we're all freaking superheroes in this room. So good for you guys. So what is your primary concern? Fear of hypoglycemia is a big one, but actually lack of confidence with insulin adjustments. Well, I hope that this is something I'll touch on today, gives you a little bit more confidence at the end of the day. Lack of time. I mean, we are choosing our primary concern. I think this past week, lack of time is definitely mine. Fear of hyperglycemia and other. Well, we'll have time to address kind of all of these, I hope, and what those other ones are. Hopefully we can get to that too. Or again, maybe these are the people that don't have diabetes and are saying, Dessi, you didn't think about us again. All right, let's get to the next slide. Sorry, 1 second. There we go. All right, so as I mentioned, we looked at in a study that was recently published, this is a really interesting slide. I just love sharing this because this study, if you're not familiar with these stacked bar graphs, it was a study that actually pooled a ton of data in adults with type 1 diabetes on exercise days versus sedentary days. So you can see over 640 days of activity compared to 478 days of sedentary, no physical activity. The data was looked at for 24 hours, so not just the exercise bout, because we wanted to give kind of a snapshot of the entire day. And from that data, this was all type 1 diabetes. What you can see is these stacked bar graphs. For those that aren't as familiar with stacked bar graphs, we're trying to keep blood sugars, and providers will always try to tell you to keep blood sugars in this 70 to 180 milligram per deciliter range, typically. We want to increase that time in range. Ultimately, at least 70% time in range is the goal. Now, can we just stop for 1 second? The goal is 70% time in range. If I'm looking at this, it's not a problem. The thing I wanted to mention is that our guidelines are kind of recommending, our providers are trying to tell 70% time in range. In a real world scenario, you can see that regardless if it was exercise or sedentary behavior on those days, we tend to see that if the guidelines are 70% time in range, sure, we definitely see an increase in time in range with exercise, as we talked about, improvements in blood glucose control with physical activity. But we also see that neither of those situations, we see 70% time in range. It's not meant to be a shaming kind of slide. The whole point is that in reality, diabetes management is hard. Every day we struggle with trying to manage what's happening with our meals, with exercise, with stress, with the temperature, all those other factors we discussed. And we do see this improvement in time and range, but what I really wanted to highlight is, yes, with exercise, we see reductions in mean glucose, improvements in time and range, less time spent above range, so above 180 and above 250, but we also see this increase in time spent below range, where it's hypoglycemia, less than 70 and less than 54. I really did want to highlight this because as much as we do see improvements in time and range, we can't ignore that if this means on more active days we're having more hypoglycemia, that means that we need to find more strategies that work for us with type 1 diabetes and how to manage and prevent these lows during exercise or in recovery. So I did want to kind of mention that, especially with the guidelines, if they're recommending 70% time in range, the guidelines also suggest with type 1 diabetes, we should be aiming for less than 4% below 70 and less than 1% below 54. These percentages are a lot higher than that. So we know that people are having a hard time. All right, so just to address some of the questions that I saw earlier in the chat, what do we do about insulin strategies for aerobic exercise? So remembering that hypoglycemia, like I mentioned in the previous slide, is very common with exercise. One option is to reduce mealtime boluses by anywhere from 25 to 75% for aerobic exercise. Usually you do this with the meal before exercise, as long as exercise is going to be performed during peak insulin action. So if you had a meal and you took your bolus, in the next 1 to 2, maybe even 2.5 hours, you're going to go exercise. This is an optimal time to reduce basal insulin. So just to show you really quickly, here's a nice little figure that I wanted to show. If on a non-exercise day, you take 100% bolus, on a day that you actually exercise, one recommendation, well, that falls in the category between 25 and 75%, you can do a 50% bolus reduction. That is kind of one strategy. Instead of taking 4 units of bolus insulin with a meal, for example, if that's what you would do normally in this kind of non-exercise day, maybe you only take 2 units here for your meal before exercise. I would always suggest start with a little bit lower. So, maybe don't reduce it too aggressively to start and then see how it goes from there. The next kind of suggestion and strategy that we've tested, and during my PhD, we looked at doing basal rate reductions. For those seeing CSII, continuous subcutaneous insulin infusion or pump therapy, for those that can do percentage reductions, for example, if you're in open loop, you can do a 50% basal rate reduction. We typically recommend doing this 90 minutes before aerobic exercise. The reason we say that is we realized in a study that we have done, and other researchers have looked at this too, it takes a long time to get insulin out of the circulation. So this is something I kind of wanted to mention as well. For those individuals on multiple daily injections or MDI, if you're taking long-acting insulin, you can still reduce basal insulin, particularly on those active days. So if you take your long-acting insulin first thing in the morning, you can reduce it by 20% in the morning. Or if you take it in the evening, you would just have to do it the evening before an active day, which would be the following day potentially. So this is kind of one quick example of, you would take your bolus insulin. Actually, you wouldn't be taking 100% bolus insulin, but if you wanted to try just the basal insulin strategy, you can reduce it 90 minutes before, for example, by 50% until the end of exercise. Then you resume it back to the usual rate. And even overnight, we tend to see a lot of hypoglycemia after exercise. You can also reduce basal rates for up to 6 hours overnight by 20%, just to help reduce the likelihood of a low overnight. One last suggestion for people on insulin pumps, if you have sort of an opportunity to do shorter duration exercise, don't have time to reduce basal insulin, or you forgot to do a bolus insulin reduction, You can do pump suspension. It has variable results. For shorter duration exercise, it may be beneficial, but for longer duration, you may need carbohydrate feeding to prevent a low as well. And always remember that these are just insulin strategies. We also have the recommendations of doing carb feeding if you want to have carbs before exercise as well. All right, we're almost finished. The last one is just kind of talking about some other strategies to reduce hypoglycemia other than adjusting our insulin rates. One thing we wanted to talk about is fasted versus fed exercise. We tend to see differences with fasted exercise. Even if it's aerobic, resistance, or high intensity, the timing of day really matters. For example, in the morning, this example was done, it was a study in 1990, aerobic exercise still caused a rise in blood sugars. So we also see that from morning exercise. Again, we talked about increases in growth hormone. We tend to see reduced insulin sensitivity in the morning, different fuel utilization, and what fuels you're actually using in the fasted state. With resistance exercise, we see this in another study that was done by my colleague in Canada, again, Dr. Yardley. Morning resistance exercise, we tend to see a rise versus afternoon exercise, we tend to see a drop. Both were resistance exercise. It was just the time of day that was different. And the same sort of thing with high intensity exercise. Even though we typically say we see a rise, it really matters on our fuel utilization and the state that we're in, if we're fasted or fed. Okay, last little study that we wanted to share is just on carbohydrate requirements. I didn't touch much on this, and I'll let Leah kind of talk more about this on her session, but carbohydrate requirements for prolonged fasted exercise. This was a colleague in Canada that looked at doing basal rate adjustments or no basal rate adjustments with pump therapy. So really quickly, just to mention the 3 different strategies. One was a basal rate reduction. It was 90 minutes before exercise, 50% until the end of exercise. And then we resumed back to the usual rate. The other one in green we see here was basically carb only. So basal rate was maintained, but carbohydrates were given. And actually it was given relative to someone's body weight. So everybody was treated with a different amount of carbs. And anytime blood sugars went below 180 milligrams per deciliter, they were given carbohydrates. And it was what the equivalent was 0.3 grams per kilogram of body weight. And in red, we see the combo strategy. So people came in for 3 different strategies. The combo was basal rate reduction by 50% until the end of exercise, but it was started at the start of exercise. So until the end of exercise. Here in the top, you can see kind of different carbohydrate strategies, how much carbohydrate was needed to prevent a low. You can see basically when you reduce basal insulin 90 minutes before exercise, you actually require a lot less carbohydrates. For people that are trying to avoid eating too many carbs or don't prefer to eat many carbs, you definitely need to pre-plan for exercise. But in the conditions where you don't mind and having carbohydrate feeding, you do see more carbs needed when no basal rate reductions are made. And in that combo strategy, you still see, unfortunately, like we mentioned, if you do reduce your basal at the start of exercise, it still takes time until the basal insulin and insulin in the circulation gets out of the body. So again, just to show you sort of the data, in the first hour of exercise, there really weren't that many differences, and irrespective of the condition. But then in the second hour of exercise, you start to see differences. You start to see that the combo strategy of reducing insulin and carb feeding maybe was too aggressive. Whereas in the condition of carbs only or basal rate reduction, that you see that blood sugars still kind of drop a little bit in the second hour of exercise. So again, just remembering it depends on what type of exercise you're doing, what type of strategy you did to prepare for exercise. And I'm happy to open up for questions at the end too. All right, let's finish up with one last poll question. I think my last slide is just coming up after this. What adjustments to insulin and or nutrition do you try to make to prepare for exercise? So now it's kind of a question, all of that stuff we talked about, what do you typically try to do? Do you try basal rate reductions, bolus reductions? You know, some people probably do a combination, so we added that. Some set an exercise target if you're on closed loop. So you can't really reduce your basal rate, but you can set an exercise target or a temp target or an activity mode. Some like to consume carbs. And some do all of the things above or a few of the things above. And some say nothing. Maybe if you have diabetes, or if you don't have diabetes, you do nothing. Awesome. That's what I thought too. 50% do a combination of all of the above. That's really great to see. It sounds like people are doing a combination, probably not all of these things at once, but definitely a combination. It may be a little bit of carb feeding. It may be some basal rate reductions. Not many people are doing bolus reductions with the meal before exercise. All right. Okay. So I said last slide, but just getting to continuous glucose monitoring, we know that CGM can be very helpful as a tool for people with diabetes to learn about what's happening, not only during exercise, but especially we're talking about exercise today. It can improve our comfort during sleep after exercise, just to know if our blood sugars are dropping low or going high. It can help to determine how many carbs we need and what insulin needs we need during exercise, because we start to see patterns and trends. We also get CGM alarms and alerts to provide us with more confidence around exercise. But one thing I wanted to mention is, I always give this figure, even though I understand many of us are adults in this room, I like to bring some child enjoyment into this as well. Think about being the conductor at the front of the train, and that's your blood glucose. Your blood glucose is always going to be first. Whatever happens in your blood glucose, the CGM is at the caboose. It's the back of the train. It doesn't mean it's not going to get there, but what would you expect here? Your blood sugar is going to start to drop, potentially like it would with exercise. The CGM will eventually get there, but it just might be a little bit delayed with physical activity. And so we actually did a study where we looked at that in black, or I'll highlight it really nicely here so you guys can see that. That is our continuous glucose monitoring. So in this kind of situation, we did a study where we looked at exercise and a meal challenge and recovery. In white with these circles, we actually did finger stick blood glucose measurements. We actually did 2 in duplicate at each measurement just to confirm that the blood glucose measurement was similar. What we see is that, for example, with aerobic exercise, an hour of activity, blood sugar started to drop. But for example, at almost the end of exercise, we see blood sugars maybe around 120 or just below, but the CGM was maybe picking up around 130. And so just understanding that this delay does occur with rapid changes in glucose. Whether that is rapid changes down or up, we tend to see delays in the CGM. And it's usually because a lot is happening in the body. We have increased blood flow, increased sweat rate, whatever it may be, we tend to see that with rapid changes in glucose, that the CGM may be around 15 or so minutes delayed. As you can see in recovery, once people sat in recovery for around 30 minutes, then you can see that the CGM and the blood sugar readings were right back to normal. So they were kind of overlapping and more accurate here. At rest, they tend to work a lot better. All right, now we're gonna open up for some questions. I know I went a little bit over time, but I wanted to make sure we have time for some questions. I wanted to say thank you all for joining on your evening, and please attend the other 2 sessions. We have some great presentations coming up from Dr. Vecina and from Leah. I can't wait to be there and look forward to chatting with everyone. Thank you all.
Oh my goodness, thank you so much. Thanks for showing the data. That was great. We have a lot of questions. You've generated a lot of interest.
Awesome.
We had some questions that were actually coming in before the talk. And so I'll start with some of those and weave in what people are asking now. So somebody's asking what physical activity training is preferred. They're thinking cardio or resistance training. And what's your take on that, Dessi?
Yeah, thank you everyone for your questions kind of ahead of time. I really appreciate these because it gives us an opportunity to think about how different everybody responds to exercise too. Again, like we mentioned, we can't just tell someone you should do this and it's going to work perfectly for you. With diabetes, nothing's really as easy as A and B. We've got to try C, D, E, F, and all the other letters just to make sure things work for us. So when it comes to physical activity, we basically see a lot of differences. It depends on what the person can do, what they're capable of, what they're interested in doing, because that will motivate people to stay engaged in physical activity. All exercise has health benefits. So whether it's cardio, resistance, high intensity exercise, one thing I wanted to mention, like even just from my personal story, is that I haven't done cardio in probably over a year or 2 at this point. I do a lot more resistance exercise and, lightweight weightlifting. So nothing really heavy. Last year, I was doing a lot more high intensity exercise where I could do a little bit less and still get the health benefits. What's really important is that the exercise guidelines recommend for adults doing 150 minutes of moderate to vigorous physical activity. So at least 30 minutes a day, as long as we're kind of elevating our heart rate to a certain degree. So just making sure it's a little bit more than what we're doing at rest. We know that there's a lot of benefits from activities of daily living, walking and gardening. These can all help us and overall health benefits, but we want to get our heart rate up a little bit, at least 30 minutes a day. And it's because this is where we tend to see the cardiovascular benefits. So heart health benefits and all of the other things that come with it. So Again, the other thing I wanted to mention too is the order effect matters. If you want to do a combination of activities, there was a study again done by Dr. Yardley looking at doing cardio before aerobic or before resistance exercise, and then vice versa on a different day, people that did resistance and then cardio. And actually what they found is that when you do resistance exercise first, you're more protected against a low blood sugar later on. So if you're trying to do multiple things in a day at the same kind of session, try to consider your kind of first and second bout of exercise and which one you're going to do first.
Great. Here's another question. This person is wondering the type of exercise, if it's aggressive, maybe more like HIIT versus low impact, how does that affect when you want to raise your blood sugar? Like if you have a hypoglycemia, does it take longer for one activity versus the other?
So did you mean so you said high intensity exercise, but is it just, because that's the other thing is it's not as clear cut on what's considered high intensity. Even kind of aerobic exercise can be high intensity. It's just not considered entirely anaerobic unless it's kind of a full sprint or very, very strenuous. So is the question about high intensity exercise like sprint based or?
They said aggressive. So
aggressive.
we could go with maybe sprinting versus low impact, like walking or hiking.
Yeah. So basically what happens with this kind of, we say anaerobic, which basically means that removing oxygen from the situation, very aggressive or high intensity exercise. You can't really sustain it for very long because you become out of breath and you kind of need a break. This is where we see that increase in adrenaline and lactic acid. So blood sugars can either stay elevated. We've actually done a study back in Canada that looked at that with high intensity exercise. It was in the morning, and what was done in recovery was basically we wanted to see, the study looked at 4 different conditions, either no bolus after exercise, we wanted to see what would happen, or trying different percentages of kind of a bolus correction if blood sugars were high. And so what we saw is that taking, 50, 100, or 150% of a bolus correction based on your insulin correction factor may be recommended for people that are stubbornly high after high intensity exercise. Again, it's very individualized. Some people notice that their blood sugars come down after high intensity exercise. Some people may notice that they're repeatedly staying elevated for hours after exercise, in which case you can try to take a small correction based on your settings in your pump, or just take a small correction based on your insulin to carb ratio.
Yeah, great. And then this person, I guess it's kind of a dual question. So this person asking about food or liquids that consumed during exercise are not readily digested. That's what they've heard. And so they're wondering what the best practice for treating a low blood sugar when they're doing activity.
Yeah, absolutely. I think we're always wondering what can work for us. I think the one thing I will say is that when it comes to treating a low blood sugar, fast acting carbohydrates is always kind of the first thing that we recommend no matter what. And some people might ask, what does that mean? Really, the closest we can get to the source of glucose, sucrose, basically straight sugar if we can. So for example, like in our pharmacies, you can go and find glucose tablets. Those are dextrose tablets predominantly, basically readily absorbed and broken down quickly in the body to get blood sugars back up. If you're having something that has a lot of fat content, a lot of protein, we're not really going to see the same rapid rise. If you're actually treating a low, things like juice or, there's jelly candies, things like this that are actually helping to bring blood sugars up, it works a lot faster in the body. And, I'm not the nutrition specialist, so Leah, you can definitely add on to this, but that's kind of my 2 cents, is that making sure the difference between treating a low and then maybe preventing a low or having carbs before exercise can be very different.
Yeah, that's great. I think sometimes too, if you feel like your gut's compromised and it's kind of feeling sloshy, like you've exercised a lot, you can always use some sublingual, like glucose tabs, put them in your cheeks and help them absorb a little bit more fast into the bloodstream versus bypassing some of that gut if you're worried about that. This person is asking, I think you've touched on this, but a very specific question. How would you recommend somebody kind of prepare for a very long, more strenuous hike, thinking plus double-digit numbers, like 10 miles or more? Like how would you have somebody prepare for that? Maybe what would they bring? And then also prep before.
That's a great question. I love hiking. I probably don't do that much hiking right now, but what I would recommend for long distance hiking is always, always, always be prepared. My PhD supervisor, who also has type 1 diabetes, when I was back in Canada, he would go on these long adventurous hikes. Like he hiked Kilimanjaro. He has type 1 diabetes. He's done some really, really crazy hikes. And what we notice in these kind of long duration and like long hikes is that you really need to be prepared. People were going through so many glucose tablets during that hike. You know, as much as you want to prepare for hypoglycemia with that long duration kind of hiking, we do recommend just making sure you're prepared by having all of the kind of low glucose supplies that you need, just like the ones that, you know, Leah was mentioning, or glucose tablets or juice, whatever is easier to carry. In terms of what can be done to, you know, prepare for it, one thing that we worry about is that you don't want to be suspending insulin entirely for too long. And, you know, Leah, you and I have talked about this, but basically anytime exercise is done for hours on end, if you stop insulin delivery for a long period of time, you can see a rise in ketones that start to develop. And really, you don't want to be seeing this. That's why your providers typically don't recommend suspending or stopping insulin for more than 1 or 2 hours, because you might start to see a rise in ketones. And even with hiking, you might still see that as long as, you know, you're exercising for many, many hours with no insulin delivery, you may see that. So just being cautious of that as well. But one thing that you could still do is that kind of basal rate reduction 90 minutes before exercise. Like we recommended 50% basal rate reduction, you could try a little bit less than that. We've even shown that an 80% basal rate reduction for an hour of activity that was done 90 minutes before exercise was still effective. But for 10 or 16 miles, you may not need to be as drastic with your reductions. And again, it depends on what you're doing. If you're on multiple daily injections, you can reduce your basal insulin either the day before exercise or the morning of, like we mentioned. There's a lot of strategies, but just making sure you're always prepared.
Okay, great, thank you. Oh, this is also a great question. So this person is asking that, or saying that they used to use temp basal rates, maybe like 50%, but now that they're on a hybrid or a closed loop, they want to try to use the exercise setting. So this person, I think specifically, is on the tandem control IQ. So they're asking, like, what are the pros and cons? Like, would you recommend just doing the exercise setting, or would you recommend trying to get out of control IQ and putting a temp basal rate?
Love that question. I wish I could have touched on everything today. Unfortunately, I wanted to make sure I opened it up for questions, but these are all questions I love because everyone uses different systems. So whether you're on closed loop, open loop, injections, it may vary. So people on closed loop, we are still establishing more of these guidelines, but from the studies that we've seen published, setting your exercise target, activity mode, temp target, whatever you want to call it, every system's got a different term for activity modes. Setting that still 90 minutes before exercise is effective and is safe. If you think about it, you don't upfront see the algorithm, but it's doing essentially what you would be doing in open loop where you're reducing your basal insulin. It's just doing it for us by not having to think as much of how much to reduce it by, and it can adjust a little bit more aggressively with the algorithm that's automated. And so what I would suggest, we've even seen in some of the studies that we've done when I worked in Australia on a visiting postdoc, setting the temp target or exercise target activity mode 2 hours before exercise was still effective in kind of preventing hypoglycemia, especially if we want to reduce the risk of lows with aerobic exercise. But we even have done that in a study where we were doing high intensity exercise. It was afternoon exercise. So keep in mind, time of day also matters. And setting it until the end of exercise is typically recommended if you're keeping the pump on, and then resuming it back to normal at the end. So again, with Control IQ, remember that you have to turn it off yourself, at least with this iteration of the software. If you turn on the, the exercise or activity mode, you have to just remember to turn it off at the end.
Yeah, great. This is kind of piggybacking a little bit on the CGM question. So this person is wondering if you've been able to study if the CGM lags, like if it's the end in the caboose, how effective is it to base your choices off of a CGM in exercise?
That's such a great question. I wish more people ask these questions because honestly, we need this. We need providers to hear this. When people aren't actually doing the research, you think that, these devices, and don't get me wrong, I could not live without CGM. I'm so grateful for the technology, but I also want to kind of bring attention to some of these challenges that probably many of you have faced and realize, if you haven't realized it yet, you may now realize that sometimes you may feel low, how you actually feel, but your CGM may not actually show that you're low yet, or vice versa. It's kind of variable, but sometimes we see that delay, especially in the low glucose range. And so how do we trust it? When do we know? I always base it on how I feel. So always thinking about how you actually feel. That being said, having diabetes for 25 years, sometimes you lose kind of awareness to hypoglycemia. So I don't always feel my low blood sugars. So one thing that I always say, even though there's kind of like the front of the train and the caboose of the train is the CGM, whatever the situation is with exercise, have a glucose meter handy and available and around, because anytime you're unsure if you should trust that reading is just to do a finger prick and test your glucose. I know many of us don't carry them around, especially with some newer technology. We see, for example, factory calibrated devices. So people say, oh, I don't need to calibrate. And it's true, on average, you don't need to, but we still tend to see these delays. So another kind of recommendation just to add to the end of this is, if you wait at the end of exercise at least 15 or 20 minutes in rest, not really doing anything, usually the CGM and the finger stick blood glucose come back together. They're a lot closer at rest. We see a lot more improved accuracy. But one thing I will also say is that as devices have advanced in terms of their technology, we just see that they work a lot better too. So the accuracy has also improved over time. When we published that study, we were using older CGM technology. And with time, we see that newer advances also mean that the lag time and the delay is also reduced. So I don't want you guys to be fearful of the activity and the CGM tracing, but just understand that if you're ever unsure how you feel and whether you're actually high or low, just have that glucose meter handy.
Yeah, great. This is another question. This person is asking what your recommendations are for exercise and weight loss with type 1 diabetes, feeling like maybe they always have to fuel with carbs and then weight stays the same. So what's your tips on that?
One of the greatest struggles of diabetes, if we're constantly treating the low blood sugars, again, I don't want to say that carbohydrate feeding is bad. We try to stay away from the language good and bad and what this is what you do, this is not what you do, because for everyone it's different. Some people enjoy eating carbohydrates and can still be losing weight. It just matters on what works for you. If you're noticing that you're treating with a lot of carbohydrates and still noticing no weight loss, maybe it's changing up the type of activity you're doing. We've seen benefits from doing cardio and aerobic type exercise. It doesn't have to be very high intensity, but we also see weight loss with even high intensity exercise. So we can't really say one type of exercise is promoted for weight loss. But we also know that if you're finding you're treating too many lows or just having too many carbs during activity and you're trying to avoid that, try to use some of these strategies we talked about today, these basal rate reductions, bolus reductions, maybe changing the time of day of exercise, whether you want to do if you're noticing a lot of hypoglycemia, try fasted morning exercise. I know for me, it's kind of hard to get up that early in the morning. Some people are super early birds and kudos to you, but that would be kind of one of the recommendations. And again, everyone's doing a great job. Diabetes is so hard to navigate and don't think that I have it all under control either. So.
Yeah, great. And then this person just, I think you've kind of touched on it, but I definitely want to also ask this person's question. She's just mentioning typically her exercise is half-hour walks. And if you want to elaborate what the health benefits are of doing half an hour walks.
Absolutely. We still see health benefits with walking. These are all beneficial things to be doing for our body, getting our body moving. Half an hour of walking is better than no walking at all. Of course, that being said, it depends on what you can do. Everyone is so individualized. Some people can't be walking. Some people may be in a wheelchair and have to do modified physical activity. Some people may have an injury they're trying to overcome and can't do running or walking like they did. So it just depends on what you're able to do. There are health benefits still associated with walking. One thing I will say too is that with 30-minute walks, you may not need to be as aggressive with your insulin dose adjustments or with your carbohydrate feeding. What we tend to see in the literature is that once activity hits kind of greater than 40 or 45 minutes, I don't want to say it's a bit speculative, but after that 45-minute window, we tend to see blood sugars are a lot more likely to drop in that kind of situation. Longer duration is sort of considered that 45 minutes or longer, even an hour or longer. With 30 minutes of activity, some people tend to see blood sugars drop. But one thing I would recommend is if you're actually going to exercise with aerobic activity like walking, if it's done for 30 minutes, right after a meal, even when you bolus, even if it's a full bolus, the safest time to exercise is actually immediately after the meal. I know many people don't think this. I was just saying you should try to exercise when insulin hasn't peaked or 3 hours after your last bolus. But in fact, when it's shorter duration exercise, 30 minutes or less, right after eating a meal and taking a bolus is technically safe. For example, if you're going to walk your dog after dinner, doing it right after you've taken your bolus and had your meal. And the reason is at that point, you probably don't have insulin peaking yet. your carbs haven't been broken down yet, but they will start to protect you from hypoglycemia. So just remembering too, the timing of exercise and carb feeding also matters.
Yeah, great. And I feel like you have been able to really well answer all of these questions. I'm trying to skim through the last just to make sure. I mean, I think there are a couple other ones just asking, but I think you've touched on them, like the best exercise to help your blood sugars, but I think your presentation touched on that.
Yeah, sounds one thing I just wanted to say about like the type of exercise too. There have been studies, I was recently looking at a study about type 2 diabetes. I know we focused all on type 1 today. Cardio, resistance, high intensity, we see benefits differently from all of these kind of activities. But for example, doing cardio and resistance together, or even within a week of doing predominantly cardio and incorporating some resistance exercise is very beneficial. In fact, with type 2 diabetes, a recent study came out that doing cardio is great and it has cardiovascular benefits. Doing resistance exercise is great. The combination of both seem to actually elicit the best results. So kind of throwing in a combination of activities so you're not always doing the same thing is also really important too. But, again, that being said, we see this in the literature, but I think I mentioned I haven't done cardio, I haven't been running. I do walk, but I haven't done any long distance hikes like some of these people doing 10 or 60 miles, which is amazing. But I'm doing a lot more resistance exercise, and I'm definitely still seeing my weight is maintained. I haven't really seen too many changes. And in fact, with resistance exercise alone, I find it a little bit easier to stabilize my blood sugars because, like we mentioned, it's a bit of a mix of aerobic and anaerobic activity. It's not powerlifting, where in that first slide, we kind of showed very high intensity weightlifting that can cause a rise in blood sugars. Typically, a resistance exercise bout where I'm doing some weightlifting, some, ab work or whatever it might be at the gym, that combination, my blood sugars tend to stay quite a bit more stable. So all exercise is definitely recommended, just trying to hit that target of 30 minutes per day for adults and actually 60 minutes a day for pediatrics. So just remembering those differences too in kids.
Excellent. And then just to finish up, is there a kind of a tip that you have or suggestions on how to get started with activity if you're not currently doing it?
Absolutely. I love that. So anyone that is either new to exercise or looking to start kind of safely exercising, whether it's diabetes related or not, there are so many fantastic YouTube channels to do kind of, they have some, whether you're entirely sedentary or looking to kind of increase your daily activity, programs like Couch to 5K, which is like a Canadian type program because it's in kilometers, but basically the idea of getting people from no physical activity to moving. These are some great there's channels on YouTube. You can find free kind of programs online to kind of get people moving. Starting off slow is always my biggest recommendation. So not doing anything that makes people uncomfortable and pushing to the point of pain. It's just making sure you start slow. And I do want to finish off by saying that if you're ever looking for more tips and kind of strategies on what exercise you can do, you can contact me directly. Like we can put my information in the chat. I absolutely am open to that. I love connecting with the community. This is what brings me joy. Don't feel like you're burdening me because this is what I love to do. And also just remembering that when you're starting to do exercise, start slow, but remember it takes 21 days at least to build a habit. So if you start, try not to give up, but remember that if we start at the gym, I always talk about this in January, why do you notice that in February, so many people have dropped off and stopped exercising, or the gym is a lot quieter in February? People don't realize it takes a long time to build habits and make changes. So these things take time. Give yourself the time that you need. You may go through lulls. Sometimes you may be more active than others, and that's okay. And the last thing is, find something that brings you joy. I always think about this because if you're not enjoying the activity you're doing, whether you're new to exercise or an elite level athlete, whatever it may be, doing something that's enjoyable will just make it easier to continue and to engage.
Great. And then somebody asked if you're willing to share your slides.
Absolutely.
Okay,
Absolutely.
Great. We can do that. Email those to the participants. Excellent. So I think with that, you've so eloquently answered all of our questions, and thank you so much for bringing the research lens in and doing all this great work and studying all these amazing things. So thank you for promoting this topic, and yeah, thanks for speaking tonight. And without, I guess we can let everybody get on to the rest of their evening. Thanks for joining.
Thank you all. And please make sure you join the next sessions. Leah and Dr. Bassina have some great talks coming up. So absolutely, please be here.
Yes, Dr. Bassina speaking next week at 7 to 8. It's off the same registration. So yeah, hope to see you all there as well. Thanks.